All right, so our next speaker is Dr. Sarah Duhon. She's a naturopath here in Baton Rouge. Illuminate Health is her practice, and it is along the back wall where she has been sweating. So she's going to give us a talk, and they work together with Jordan. So please help me welcome Dr. Sarah Duhon. Okay, so when I ask you about, all right, okay. So when they ask me what topic I want to, I said, let's just do something general. A lot of people don't understand what I'm trying to say when I say naturopathic medicine, root cause medicine, functional medicine. So let's just start with the basics. So the way that I thought I could explain it best is through a story, so bear with me. Okay, here's a story about a mysterious smell. There's a woman about my age. She's walking through her house, goes into her kitchen, and she noticed something stinks pretty bad. So she locates where it is. It's in the trash can. That makes sense. So she goes over, she doesn't smell too good. What am I going to do about it? So she calls her kitchen doctor. Her kitchen doctor says, come on in, I know exactly what to do for that. I see it all the time. He says, what I want you to do is I want you to go fill this prescription, take this spray it once in the morning, once in the evening, and then come back and tell me how that works. 2 weeks, smell comes back. Worked for a little while, but not too well. So he says, 2 sprays in the morning, 2 sprays at night. Okay, let's see how that works. A few more days come by. That smell's breaking through. What the heck am I going to do about this smell? I don't understand. So he says, you know what, this is beyond my control. So I'm going to send you to the garbage can specialist. So she goes into the garbage can specialist, and he says, I know exactly what to do about this. I see it all the time. Now I want you to take this blade plug it in the wall. It's going to be 24-hour extended release. So now you've got 2 sprays in the morning, 2 sprays in the evening, and an extended release all day long. Yeah, okay, I guess I'll try that out. In the meanwhile, she's still piling trash in the trash can, and she's not quite understanding that the problem could be what's in the trash can. So she does that for about a week. Something else starts happening. Not only is she getting headaches from the sprays and the blade plug-in, she's now noticing that there's flies all around. So this is not working. So she asks a friend, and the friend says, hey, I'm with this integrative practitioner. And this integrative practitioner uses other things. Other than the toxic sprays, we have something that's a little more natural. So she goes to the integrative practitioner, and she says, you know what? Toss that stuff, it's so toxic. I'm going to give you some sage. You're going to light the sage in the room, or you get rid of that smell. Okay, do you think that's going to work? Yes, and then you're going to put some fly traps out to get rid of those flies. So, okay, I don't know if this is a solution, but I'll try it. Well, at least her headaches went away, and the flies got trapped, and the smell went away, but guess what? Something else happened. Now she's got roaches, now she's got rats, the trash is piling everywhere. She doesn't know what to do about this. This is not working, guys. So she finds another practitioner. This other practitioner says, look, all of those things, I want to ask you one question, not about those things, but when did the smell start? When did it start? And she said, no, I didn't think about that, but I guess I was cooking some shrimp and seafood gumbo with my family, and we all had a great day the day before. I was so happy, and then the smell started the next day. Okay, well, then let's ask, where did you put those shrimp peelings? Where did you put the crab peelings? Where did they go? Well, in the trash can. And he said, okay, well, I have an idea. Why don't you take the trash out? And she looked at him and said, well, let me see how that works. He says, on the way out with the trash, throw the Lysol cans away, throw the blade cans away, throw the charcoal bag and the fly trap, because all of those things are probably going to go away when you take the trash out. So this model, you say, okay, well, what made more sense? Are we going to mask the smell, Or are we going to remove the trash? And for this situation, you're going, well, duh, everyone takes their trash out. But this concept applies to the conventional medical model that we use today. With allopathic medicine and naturopathic medicine alike, we're trained in a specific model. Treat the symptoms, treat the disease. There is a problem with that because the symptom is what? The smell, the flies, the rats, but we're missing something there. There's only so much that you can do with the symptoms. In allopathic medicine, to treat the symptoms, to treat the disease, we're using medicine, surgery, radiation, and then some practitioners are what we call green allopaths that like to use supplements and more natural approaches. With naturopathic medicine, how I was trained, we're taught in medical school how to use diet, lifestyle, supplements, herbs, homeopathy, but to do virtually the same thing. Now, when you use diet and lifestyle, you have better outcomes. You don't have the side effects. It's wonderful, but is it really treating the root cause? Because the problem is, people think symptoms are the problem, but symptoms are not to blame. Symptoms are the body's way to communicate. It's the body's way to give us an alarm. It is our body's way of healing. We all know if you get a cut on your arm, there's going to be some inflammation. That's a natural process. Your immune system's going to work. And guess what? That happens all over your body in places that you can't see it happening. So it happens in your vessels. And then your body repairs it with cholesterol. But then if it keeps happening and you don't treat that root cause of why your vessel is being hurt, just like the cut, you get an infection. So then what does it do? It forms a scab. And so this idea, this concept, can be applied all over the body and every organ part. Because symptoms start usually with some form of deficiency in the body. This is when they're mild, and usually when we tend to ignore them. Then that deficiency leads to some kind of blockage of a pathway in the body. That can be the nervous system, the digestive tract, that can be the urinary system. It's a blockage of some sort. Even an emotional blockage. When you ignore that symptom, or you try to stop those symptoms, what it leads to is a damage to a system. So the symptom is a way of speaking to you. It's saying, hey, something's not right. Hey, we're working really hard at trying to repair this. And sometimes the symptoms come and go because the body did its job. So do we really want to stop those symptoms when it's working? No, but if it persists and the symptoms get worse, they change. That's when we say, wait a minute, a bigger problem, like a damage to the system is happening. Do we want to shut those symptoms up? Or do we want to figure out what's causing those symptoms? So treating only symptoms never cures a disease. It only prolongs it. Many of the medications out there, they're not curing, they're prolonging it. They're making you feel better. But with that, when you silence the symptoms for too long, it can become very dangerous. So let's say your chest starts to hurt. You go into the doctor says, oh, that's called angina. You say, well, I'm glad I have a name for it. But what does that mean? Well, it means you need to take this medicine, so anytime you feel that pain, it can dilate your vessels so you won't have a heart attack. Okay, but why do I have angina? Why do I have that tightness in my chest? Well, I'm so glad that you do, because that's your warning sign. That's the body working, the body telling you, hey, do something about this. Not shut me up, but do something about it. So root cause medicine is when we ask the questions, how, where, when, why? Why is this happening? Where does this come from? And when you ask those questions, you start getting some answers, and you start getting a pathway on how you can reverse disease. A lot of times this starts with foundations of health. It starts with your diet and your lifestyle. But that's because usually the root cause is our diet and lifestyle. But for some people, it may be a toxic exposure. For some people, it may be a death in the family or a psychological shock. But we have to find that root cause. After that root cause and symptoms persist is when we start looking for triggers. And when you identify those things and you remove it, it's just like taking out the trash. Some people's trash bins just happen to be a lot more full than others because how long have we been ignoring it or masking the symptoms? So what makes more sense at this point? Masking the symptoms, or masking the smell and the story, or removing that root cause, removing those triggers, just like removing the trash. So my name is Dr. Sarah Duhon. I own Illuminate Natural Health, and this is what we do for people. It's not an easy road, it's not a quick road. For most people, it's a very long journey because you're reversing damage of years and years and years. But we try our hardest to not mask symptoms, but to listen to your symptoms and actually, dare I say, thank your body for giving you those symptoms, because if you didn't have them, you just wouldn't wake up one day. If you didn't have a chest tightening, you would just have a heart attack. So we listen to and we honor all of those stages of a disease process, and instead of paying attention to every symptom and make a diagnosis out of it, we are looking at the entire person, their entire history, everything combined to come up to a plan that is unique for them and unique for their situation, and basically help them take the trash out. Thank you.
Thank you, Dr. Duhon. That was fantastic. All right. It was a wonderful talk.